Nyeri is a county that is bedogged by a huge disease burden, NCD disease burden. Out of 3 deaths in this county, 2 are directly linked to non-communicable diseases. It's a sorry state of affairs. It's a state of affairs that we have recognized as a county government, and we have done something about it. Number one thing we have done about it is Governor has appointed me to champion the UHC agenda. Number 2 thing that we have done is that we are every month going around conducting medical camps, not really to deal with the curative side of things, but really to sensitize our people on the preventive measures of NCDs. Our vision is to see that every one of our 2,510 community health volunteers have a BP machine and a glucometer, so that then we bring the services to our villages and we begin to propagate the agenda of preventive healthcare. We are looking to train our community health volunteers so that they can have the nutritional knowledge and we can begin to propagate the story in the villages. We are taking women as the carriers of the lead role for nutrition in this county, because we believe the woman is the one that nurtures her family. Distinguished guests, ladies and gentlemen, I take this opportunity to welcome you all to this second UHC conference and to Nyeri County. I'm indeed delighted to be part of this gathering and to participate in this critical conference. The theme for this year's conference is UHC for Sustainable Development, with a focus of transformative solutions to halt and reverse non-communicable disease epidemic. I am delighted to note that the theme resonates with my government's top priorities. Let us not take it for granted that this second UHC conference is taking place at a time when the world, and Nyeri County in particular, is grappling with the rising burden of non-communicable conditions. Further, the conference comes at a time when the President has reiterated his commitment to improving health of Kenyans through prioritizing UHC as one of his big 4 agendas. There cannot be a greater political time than this. This conference provides us with an opportunity to reflect on the burden posed by non-communicable conditions through sharing experiences and best practices, tracking the progress of implementation of our policies, and advocating for multi-sectoral engagement in transformative journey of halting the epidemic. Despite NCDs accounting for 28% of the disease burden, funding allocation to deal with the problem has not been commensurate due to competing priorities. It is against this background that the country has been scaling up investments across the health pillars as part of health system strengthening and support required in the fight against NCDs. Ladies and gentlemen, to reverse the even halt the burden of NCDs, there is need for sustained focus and increased investments, in particular in NCDs prevention and treatment. We therefore need greater attention paid in institutionalization, screening, health promotion, creation of awareness for lifestyle change and risk factors for NCDs, procurement of essential medical supplies, provision of specialized diagnostic and treatment facilities, enhanced advocacy, and strengthening of partnerships. As we are all aware, NCDs are distressing to the family, profoundly affecting both family daily functioning and economic situation due to both the loss of income and the expenses associated with healthcare costs. Ladies and gentlemen, the role of UHC towards sustainable development is not in doubt. I'm glad that Nyeri County has been selected as one of the 4 pilot counties for UHC under the President's Big 4 agenda. My government believes that UHC will build on our vision, which is a healthy county with a happy, healthy, and secure people. We are committed to fulfilling the Constitution provisions that guarantee all citizens the right to access the highest attainable standards of health. Our commitments are reflected in our 5-year County Integrated Development Plan, our CIDP, and demonstrated the achievements we have made over the last 12 months. To support UHC rollout and implementation, the County Government of Nyeri commits to health systems strengthening in the health infrastructure, in human resources, for health, in procurement of medical equipment and supplies as part of strengthening primary health care. Ladies and gentlemen, my government allocates approximately 40% of its total county budgets to the health sector. However, there is adequate funding from capital projects, with 75% of the funds going to cover personal emoluments. Insurance uptake is notably low in the county at 32%, and out-of-pocket expenditure high at 43%. We are desirous of changing this health financing picture. Moving forward, the County Government of Nyeri will be focusing on strategies geared towards increasing enrollment to NHIF, as well as other insurance schemes. This will provide financial protection through reduction of out-of-pocket payments when accessing care. In this regard, I call upon all Kenyans to register, and especially Nyerians, to register with NHIF and other private and community-based health insurances to ensure that they are not impoverished by the burden of paying health care from out of pocket. Ladies and gentlemen, in this journey, we aspire to progressively shift our main focus from ill health and hospitals to communities and empowering families to take charge of their own health. This, by extension, will play a key role in reversing the trend of NCDs in this county. In this regard, my government will ride on our very robust community health systems comprising of 251 functional community health units spread across the sub-locations in the county. In the last 1 year alone, our 2,510 community health volunteers screened in excess of 20,000 community members for diabetes and hypertension. We believe that our community health programs will increase a platform for successful rollout and implementation of the UHC program. Ladies and gentlemen, the Constitution of Kenya 2010 under Schedule 4 devolves health functions to the county governments and clearly defines functions of county governments and national governments. The same constitution recognizes the need for mutuality and cooperation and consultation in delivering services to our people. My government fully appreciates this expectation and has continuously worked with national government with success. Our collaboration in the Managed Equipment Services Program, renovation and equipping of our cancer unit, and the soon-to-be established specialized eye and dental unit at the Nyeri County Referral Hospital is worth emulating. Allow me to specifically appreciate the national government for elevating Othaya Level 6 Hospital, specializing in management of NCDs. This facility will be one of a kind in the country. Towards ensuring our decisions are informed by credible data, we are cooperating on the automation front. Our current collaboration with national government in automating Nyeri County referral and Mukurweini hospitals is progressing well. This is to be scaled up to other hospitals, rural health facilities in the next 5 years as part of a transition to electronic medical records and health automation required for improving data collection and evidence-based decision-making. I urge you to delve deeper into how county governments and national governments can optimize the gains from current and future collaborations between the two levels of government on NCDs and NCD-related activities. Finally, I call upon all stakeholders across sectors to join hands in confronting and halting the burden associated with NCDs. To the organizers of this event, we appreciate your gestures and commitment, and we commit to continue advocating and dealing with NCDs beyond this event. Let us all commit to be champions and ambassadors for NCDs. Thank you, and God bless you.